training. This is the
Recording has started.
This is the first time that we have ever attempted a virtual field training. So this is going to be very interesting. All right, and we have 45 people on the line, which is nice. Additional people I can see joining. I think we just had somebody from Pakistan and Cambodia. We have Thailand, Vietnam, Laos, Sri Lanka, Malaysia, Nepal, Pakistan. Do we have anybody from Indonesia? Anybody from India? Oh, Bangladesh. We have from Bangladesh. Okay. I see. Okay. Hamza. Okay, Hamza from Kabi. Welcome. So we have also Pakistan and Bangladesh. Very good. Aminur, okay, from Bangladesh. Okay, very good. Do we have anybody from Philippines? Anybody from Philippines on the line? I could see a whole group just joined from Pakistan. Welcome. Anybody from Philippines? Anybody from Indonesia? Kanya, I think we have another. All right, we have somebody from the Philippines. Julio, welcome. And Dr. Tang Tran from Vietnam, welcome. Okay, so I think we'll get started. I hope that everybody had a chance to look over the YouTube videos that I sent, and that's a bit different than what our actual work is going to be, but I think it's a good background to start to give you some idea on the kind of work this is. I also want to thank our cooperators and sponsors. First and foremost, thank you very much. If there's anybody from STDF on the line, want to acknowledge your very generous support for this project. Also, USDA for their support for this project. A lot of this was developed based on some initial work that I did in cooperation with USDA. So thank you very much. APARI is our cooperator based in Thailand, and they are helping to organize this meeting. They're doing the IT work and making sure that the platform is operating properly. Later, they're going to be helping with the slides. All right, and I think then finally, in addition, our newest group here is Pakistan. So many thanks to USDA, Foreign Ag Service, and USAID for making that possible through their generous support. And most likely, and then finally, I would like to thank my own organization, IR4, Interregional Research Project number 4, for allowing me to have the time to be able to be involved in this important project. So what you should see on the screen is a an agenda for today's webinar. So we will start with an overview of GLPs, followed by reviewing what an actual protocol looks like. That will be followed by standard operating procedures. Then we will have a break. Then we will review quality assurance auditing, followed by sprayer calibration and walking speed, and then talking about some of the equipment needs for doing the field work. So for those of you who might have joined the laboratory training, a lot of the laboratory training also covered the GLP aspects of this type of work. So Wayne did an excellent job for those of you who participated in the last webinar. So I'm not going to really be going that much over the laws of the GLP. What I'm going to be focusing on more is how to take the GLPs and how to implement them into the practice of the field trials. So Nui, if you can change what we're seeing to the first PowerPoint presentation called GLP Overview. All right, we're up to 59 participants. That's very good. All right, can we get a full screen on that? Excellent, excellent. Let me move this thing to the side so I can read. All right, so as I mentioned, we're going to start off with the number one item on the agenda, which are good laboratory practices. So I'm going to just simply be providing an overview. Next slide, please, Nui. Okay, so what are good laboratory practices? GLP, as it's often abbreviated, is a quality system concerned with the organizational process and conditions under which studies are planned, performed, monitored, recorded, archived, and then usually reported to a regulatory agency. GLP ensures the quality, integrity, and reliability of data. Oh, I see we have another participant from the Philippines and another from Laos. Welcome. Next slide, please. Okay, so why do we need GLPs? So this didn't start from field work, and it didn't even start with pesticides. It really started in relation to pharmaceutical testing. So in the 1950s, 60s, and 70s, there was industrial biotest laboratories, and they performed about 35% to 40% of all U.S. toxicology testing. Audits determined that some of the studies were invalid due to numerous discrepancies between the study conduct and the data. And that's why the GLPs were developed. Next slide, please. So sometimes when I visit countries, they say, can I get certified to do GLPs? There are some differences between what is done within OECD, what is done for ISO, and good laboratory practices. So I'll sort of review some of those and explain some of the differences. Next slide, please. Okay, so what is certification versus GLP? So a number of you who might work in the lab might be familiar with ISO. So under certification has a group, our ISO members. It's designated for repetitive studies, and it's a description of a quality system in a quality manual. Under US GLPs or OECD, those are generally developed under EPA or OECD member countries. They're designed for single studies. And it's also a description of a quality system, but with SOPs. Next slide, please. Okay, so under certification, there's some general statements for responsibilities of personnel, whereas under GLPs, there's very specific responsibilities for personnel. Under certification, there are no specific requirements for storage of records and report. However, under GLP, there are specific requirements for storage, retention, and archiving. Next slide, please. So under certification, there are no specific study plans or protocols required. They do have standardized methods that are used. However, with GLPs, we have a specific study plan or protocol required for each study. Also, under certification, there are written operating procedures without a specific format. However, under SOPs, the GLP SOPs, there are detailed requirements for format and content. Next slide, please. Okay, analysis methods must be verified through interlaboratory test with certification. However, under GLP, there's validation through interlaboratory tests are not required. So certification is a measure on your ability to perform an analysis or procedure in order to conduct research or analysis in the future. Okay? So certification is stating what your qualifications are at one point in time, and then you're proceeding to do research under that certification. However, under GLPs, GLPs are a documentation, an auditing procedure on how well you're actually performing in a research activity. Right? Next slide, please. So GLPs provide a framework for responsibilities of the key personnel, the general requirements for the testing facilities, requirements for handling and distributing test substances and reference materials. It includes a study planning and conductance or protocol. And it also has rules regarding generation of records, report preparation, and their retention. Next slide, please. So some of the definitions under GLPs. The sponsor is the entity that pays the bills or is sort of the overall financial supporter of the work. If it was a company, they would generally hold the registration. It's usually some type of government entity, not a company or a consulting company. So the study director is an individual responsible for the overall conduct of a study, and they are the single point of control. So the quality assurance unit is any person except the study director, management, or other individuals involved in the study, designating by the facility management to perform the duties to quality assurance of the studies. Testing facility management is the management where the study director resides. Next slide, please. So the testing facility is the person or actually the site that actually uses the test substance in a test system. So a study is any experiment or one or more tests in which a test substance is studied in a system under laboratory conditions or in the environment to determine how to predict its effects, metabolism, product performance, environmental and chemical fate, persistence and residue, or other characteristics in humans, other living organisms, or media. It does not include basic exploratory studies. Next slide, please. So a person is an individual, partnership, or corporation. A standard operating procedure is a written, approved procedure that describes in detail standard and repetitive processes. A protocol is an approved written document that clearly indicates objectives, study design, and all the methods to be used in conducting the study. The test system is the entity that the test substance is tested in or added to. So in the case of our studies, I have a question. What do you think the test system is going to be within our protocol? Anybody want to try to answer that question? What will be the test system? We'll have a few test systems, but they have something very in common. So remember, this is field training, virtual field training. And so what do you think the test system is going to be? Anybody like to try to answer that question? You can add your answers. You could try to answer in the chat box. Okay. Well, if I can get the next slide, hopefully maybe some people will be adventurous and try to answer that question. If not, we'll move forward. Thank you. Hello, Sri. Oh, glad you have come. Our first participant from Sri Lanka, from Indonesia. So now we have, who do we have? We have countries of Thailand, Vietnam, Laos, Cambodia, Sri Lanka, Malaysia, Nepal, Pakistan, Bangladesh, Philippines, and Indonesia. All of you are welcome. All right, so continuing on with the presentation, the test substance or article is any material or device administered to a test system. So in our case, the test substance we're going to use are the formulated pesticides. So has anybody come up with an idea on what the test system we're going to apply the test substance to? Nobody has come up with a potential answer for that question? Okay, well, the test system, they're going to be plants, right? So depending on what protocol you're going to have for your country, it could be chili pepper, it could be greens, it could be basil, it could be dragon fruit. Okay, so Sri, yes, she answered the chemical pesticide formulation and followed by a biopesticide. Very good. All right. So a reference substance is any chemical substance or mixture, analytical standard, or material other than the test substance, feed, or water administered to or used in analyzing the test system to establish a basis or comparison. So what do you think are the reference substances that are going to be used in this study? Now, they're not going to be used in the field, they're going to be used in the lab. Anybody want to try to guess what the reference substances are? The answer is right on the screen. Okay. Lakshani, I think your answer, traceability. Yes, traceability is what you're trying to achieve, sort of. And Farak has answered pesticide standards. Very good. Congratulations. Correct answer. So the reference substance that we're going to be used is not going to really be in the field. It is going to be in the laboratory. And so there's been an update on our answer, traceability standards. Yes, we're going to use those standards in the laboratory as a comparison to determine the concentrations of the test substance, which is the formulated pesticide, which we've added to the test system. And remember, the test system are going to be the plants. So a number of you got the answer right, pesticide standards. And they're going to be used as a comparison to trace the product. Okay. So the control substance is any material other than the test substance administered to the system. We're not really going to use control substances in our studies. Next slide, please. So we've gone over this with Wayne, so I think I'll skip this. Next slide, please. So what is raw data? The raw data is any laboratory worksheets, records, memorandum, notes, or exact copies that are a result of original observations. And actually, there is raw data that is generated both in the field and in the laboratory. And soon we're going to learn where we put that raw data. There could also be computer data as defined as either magnetic media or the first hard copy printout. Data cannot be overwritten or erased. And that's very important if they're using some kind of computer data management system. And the archives are where the data is stored. Okay. Next slide, please. So, protocol. The study must be conducted according to an approved protocol. The protocol specifies how the study is to be carried out. It has enough detail so that those actually conducting the study can envision how the study is to be conducted, and at a later time, one can envision how it was done. Okay, so we've talked about protocols and we talked about SOPs. Okay, next slide, please. So what is a standard operating procedure? A standard operating procedure for each routine activity, there needs to be a standard SOP that describes how the activity is performed. These serve as a cookbook to outline the activity. For examples, you may have an SOP for your field work involving equipment use and maintenance, or chemical handling and storage. So what do you think happens if the protocol gives a description on how to do a certain activity, but the standard operating procedures say something else? Should you follow the protocol, or should you follow the standard operating procedures? Anybody want to guess the answer to that? For those of you who have been through GLP training, you should already know the answer to this. So we'll see. Anybody want to guess an answer? You can type it into the chat box. So if you have directions, this is the question again. If you have directions that are given in a protocol, and you have different directions that are indicated in your SOPs, what do you follow? Do you follow the protocol, or do you follow the SOPs? Okay, so if you'd like, you can try to answer that question in the chat box. All right, we have two answers right at the same time. So, Dr. Farak, Sunil, and Bunsang Nong have all answered correctly. The protocol. So the protocol is what you would follow if there's a difference in between what the protocol says and the SOPs. All right, very good. Got a sharp group here. All right, next slide, please. So good documentation is the key. Documentation should permit the complete reconstruction of a study. So it's important that you record data directly, promptly, and legibly in indelible ink. You never use pencil. You initial and date all your observations and any changes, but do not obscure the original data. You initial and date only work you performed. You don't initial and date for somebody else. And do not document selectively or in advance of the activity. Okay, next slide, please. It's important that you don't use any whiteout or correction fluid tape. Do not use ditto marks as raw data. Copy all heat-sensitive paper and stamp as exact copy. Explain why any raw data it was not used. Verify critical calculations using a second person and document it. Next slide. Properly head all the pages, tables, and columns. Describe any statistics that you might use and the calculation. Sign, date, and file automated printouts. Example, quality control forms. And retain all raw data in the study file. Next slide, please. So documentation must be fully documented in the field data notebook to be able to accurately reconstruct what you have done. Keep all original observations, including all the observations recorded directly in a computer. Sign and date all computer printouts and never backdate anything. Next slide, please. So raw data. All changes to raw data must be made without obscuring the original entry. And all entries or changes must be initiated and dated by the person making the change. And it has to be accompanied by an explanation for the change. Okay, next slide. So this is concerning documentation of amendments and deviations. So Wayne went over some of this. We now commonly call these changes, but an amendment is a planned change to the protocol, and this is done in advance of the time of the event or action. A deviation is something that's done during the study that's different from the protocol. Okay, next slide, please. These are some of the key parts of the amendment and deviation. So you would include things such as the change number, the project title, the number, the field ID number. If it was in the laboratory, you would include the laboratory ID number. Describe what the change is. Explain what the reason is for the change and any impact on the study. So it also has a line here for authorization. Okay. So who do you think is able to provide the authorization? Okay. So if you'd like, you can try to play along here and try to provide an answer to this question in the chat box. Who do you think is authorized, or who is able to authorize, I should say, an amendment or deviation? All right, so we have an answer, the study director. All right, very good. Wow, you guys know all the answers already. Did you take this class before? I think some of you had, but we have new people here, and they seem to be understanding it very well. That's great. All right, next slide, please. All right, so this sort of shows the overall structure, okay, under GLPs. So you have facility management, under which there is a study director. So the study director provides the field data notebook, and any other raw data is provided to the study director from the field research director. The study director also provides the protocol, after which it is reviewed by QA. QA monitors the activity in the field. The field research director sends samples to the laboratory. The laboratory is also, their work is also monitored by quality assurance. And then the study director will write a final report, which is reviewed by quality assurance, and that is submitted to the archive. Okay. So during these processes, I have another question. See if you know this one. So I've sort of here in this triangle, what do you call the type of paperwork when, for example, the field research director is providing samples from the field work to the laboratory research director? What type of paperwork do you think would accompany that? That's the question. There's a certain kind of form that you would use when you are sending the samples from the field to the laboratory. A very similar kind of form would be used when the laboratory would be forwarding information such as the analytical summary report to the study director. A chain of custody form. Wow, you guys know everything. Excellent, excellent. We have a really sharp group here today. That's great. Okay, next slide, please. So what are some of the most important parts of a GLP program? Some of the top 10 are to appoint a study director and quality assurance. Participants must be competent as a result of education, training, and experience. And you're getting some of that training today. You must follow the protocol and standard operating procedures. You must conduct studies in adequate and clean facilities and identify the test and control articles and document their use. Okay. Oh, we have another participant from Indonesia. Welcome, Nelly. Next slide, please. The study director is the single point of control for the conduct of a study. It's important to document and correct all deviations. Very important, do not commit any fraud, and all information must be signed and dated. Everything related to a study must be archived and controlled by an archivist. Do not allow any pencils, whiteout to be kept at field or laboratory facilities. Everything must be written in ink, and any corrections must allow the viewer to see what the original entry was. All right, next slide, please. So this completes our first section, which is the GLP overview. Does anybody have any questions about this section? If you have some questions, you can type them in the chat box. All right. If not, we will move forward. So can we have the next presentation on the protocol? All right, so we're up to 71 people. That's fantastic. Okay, so Nui, thank you for loading the protocol, which I guess she's attempting to do at the moment. Again, if you have any questions about what I covered in the GLP overview, please, by all means, ask the questions. So what I see is a blue screen. It's a nice blue, but what we want to see, all right, very good. So we have a protocol. So Wayne also discussed the protocol, and he reviewed a section of a protocol related to the field, related to the laboratory aspects of the protocol. So I'm going to be covering the field aspects of the protocol. So the first protocol we have here, and I will be sending all of these presentations to you when we are completed. Okay. So here we have the protocol for spinetoram on dragon fruit. It has a project number 11514, and this was back in 2015. So this was involving the active ingredient spinetoram and the magnitude of the residue on dragon fruit. Okay. So let's skip down to section number 5. All right. So you can see here it has a listing under number 4 for who the study director is. And that's one of my fellow co-workers, Mr. William Barney, here at R4 headquarters in Princeton, New Jersey, USA. It lists the proposed dates. So you remember you went over with Wayne what these dates are, right? So you have a proposed experiment start date. So this is not the start date. We have here a proposed experiment start date. So we have a question in the chat box. Sometimes we receive translated reports. Who should be certifying that? Can you give me a little more example on what type of report you're talking about? Our entire project is going to be in English. Okay, so I don't think we're going to be having any translation in our work unless you have some internal documents that might be in your language. So our expectations are that everything that we're going to be working with in these studies is going to be in English. Okay? All right. And then you also see that study authorization, the signature and date of the sponsor, and the study director, as well as the study director's initials. Next slide, please. Or I'm sorry, can you go down to number 8? Next page. All right, so right there in the protocol, it says that these studies are going to be conducted under good laboratory practices. All right, so the appropriate testing facility, both the field and the laboratory, will be responsible for certifying that the study is conducted in accordance to GLP. Okay, So there was an additional part of the previous question, toxicology reports during the evaluation. I'm asking if that as a general official works. In this particular project, we're not going to be involving any toxicology work. If there was anything that did need to be translated, you would a few things. You would have to have the original in its native language. You would have to have a certified copy. So a certified copy would be marked true copy, and it would be have the initials and date of the person who made the true copy. Then it would have to be translated. It would have to have the initial and date and name of and contact information of the person who is doing the translation. And then they would also have to provide their qualifications to the sponsor so that testing facility management can review and determine whether or not they're qualified. Okay. So section 9 of the protocol involves quality assurance. And so quality assurance statement will be submitted with the final report, and any findings would be reported to the study director. So item number 10, in this particular protocol, the test system or the crop is a dragon fruit. So use a commercial variety, report the variety, the age of the plant, and any other descriptive information. Number 11, test system design. So each test site will consist of one untreated plot and one treated plot. So in our case, our treated plot is going to have a multiple combination of test substance all applied to that one treated plot. So the individual plots will be large enough so that no more than 50% or half of the harvestable crop will be sampled. And it also tells you that one of the trials, 11514.15 FL166, will be a decline study. So our projects will also have decline studies. Also informing the study directors and informing the field research director here to make sure that there are adequate buffer zones. This is a protocol that was developed for work in the US, so we're using US units. Here we have feet. My apologies. So we have 50 feet, which is, I think, about 20 meters or so. So a minimum of 20 meters is strongly preferred. However, it also depends on what kind of equipment you're using to make the application. If you're using something that has a very fine spray, such as a mist blower, we recommend a minimum of 50 feet, but 100 feet is strongly preferred. Okay. Can we skip down to section 13? I think you might have passed it. 13, okay. So the test or control substance. As I mentioned, we're not going to use control substance, but we are using test substance. So it says to use Delegate, which is the brand name of the product, which contains 25% active ingredient, and the active ingredient is spineteram. So contact the study director if there's any concern over the GLP status. Okay, can you scroll down to section 11, scroll down to section 14. Okay. So we're going to simulate commercial application practices by applying the test substance in a way that represents an application technique that is used in that area. So the equipment should provide a uniform application and result in adequate penetration and coverage. So when you mix up the test substance or test substances with water, this water is going to be our carrier, they should be used within 30 minutes of mixing. And if you have multiple trials, don't use one mixture on a subsequent trial. Okay, going down to 14.2. You can go up a little bit, please. Okay, good. So, not only do you have to apply the test substance, your equipment has to be fully calibrated. So what does a fully calibrated piece of equipment include? It includes the output. That means the amount of water that is coming out of the nozzle or nozzles. It consists of a minimum of 3 consecutive documented checks for nozzle or hopper output, as well as speed, equipment, or walking speed. When the output is rechecked, it's not necessary for an air blast to check individual nozzles. The variation of the total output recorded for any one of the 3 checks must be not greater than 5% from the mean for the full calibration. So you're allowed 5% from the mean. So when we say 5% from the mean, that means it can be 5% over or 5% under the mean. Okay, so for those of you who are mathematically inclined, let's say we calibrated the sprayer and we had an output of 100 mils per second, and you're allowed plus or minus 5%. How many mils do you need to collect to be within plus or minus 5% if your mean output is 100 mils per second? Anybody want to try to answer that? All right. Wow. All right. Very good. 95 to 105, right? So you would take the 100 mil per second mean times 0.95, and that would equal 95 mils, right? So that's your lower limit, right? And then you also take 100 mils per second, which is your mean, times 1.05, and that would equal 105 mils per second. Okay? Everybody understand that? So if you're in the process of calibrating a sprayer and you had results, let's say your results were 100, 100. So 100 is acceptable. 100 is acceptable. Let's say your third try was 110, and then your fourth try was 100 again. Would that be good? Yes or no? This is a yes or no answer. So you had 100, 100, 110, and 100. Is that acceptable? Yes or no? Anybody want to answer? You could type your answer in the chat box. Okay. Okay. We'll let some people think about whether or not that's acceptable, and we'll come back to that. Okay. So a discharge or output calibration must be performed just prior to the application. Another complete calibration must be performed when the application parameters or the equipment has changed between applications. So if you take part of the equipment and you move it somewhere else for different work, and you change the nozzles or you change pressure or you do something with the sprayer that changes it, you have to go back through a full recalibration. If you did not change anything, then all you need to do is to do one recheck. As long as that one recheck is within the plus or minus 5%, then that is considered acceptable and you don't have to do a full recalibration. Okay, so nobody's answered the question yet. This is a yes or no answer. Okay. So you had output of 100, 100, 110, and then 100. Okay. So you need 3 consecutive. Does everybody know what the word consecutive means? It means 3 in a row. Okay. So you remember you had 100, 100, 110, and then 100. Right? So you have 100 is good, 100 is good, 110 is not good, and then 100. So you have three good nozzle outputs. However, they're not consecutive. So, oh wow, somebody already calculated the variation. So actually the answer is no. Why? Because you do not have 3 consecutive. Okay, because you had 100, 100, 110. This one is not acceptable. So you did not have 3 consecutive. Now, if you had 100, 100, and 100, that would be acceptable. Or if you had 95, 100, and 105, that would also be acceptable. Because all 3 are within the range of 5% of the mean. Okay? Very good. All right. Can you scroll down a little bit more? Keep going, please. Okay, let's see. Let's go to section 15 of the protocol. All right. So section 15 is telling you what the treatments are. So you see, remember they tell you you needed 2 plots. One plot is the untreated control, and the other is the treated plot. So it's telling you, this section of the protocol tells you what the target rate is for the active ingredient, what the target rate is for the formulated product. So on an active ingredient basis, it's 0.0938 pounds active ingredient per acre. The target rate on a formulated product basis is 170 grams per acre. It tells you what the acceptable range of the spray volume is. This is in gallons per acre. Don't worry, when I make the protocol for all of your studies, they will all be in metric units. Okay? This is just an example. It also tells you the number of applications. If you scroll down a little bit, please. So you're going to be making, in this protocol, 4 applications at intervals of 4 plus or minus 1 days apart, with the last application 1 day before harvest. And then for a decline study, you make the same application, but you make the last application on the first of multiple harvests. In other words, you'd make your last application on day 0. Okay? And then you'd be sampling at 1, 0, 1, 3, 7, 10, and 14 days after that application. Okay, can we go to section 17 of the protocol? I think I've skipped something which might have been important here. Can you please go back up to section 15? Okay. Can you scroll down slowly, please? Okay. I think we need to go back up. I think I might have skipped something in section 13. 13 or 14. Let's see. Okay, stop. Right there. So section 14.3. Okay, very good. Okay, so we talked in section 14 about calibration. So calibration is knowing about your walking speed and your sprayer output, because that affects the application rate. So that's preparing. When you're doing a calibration, you're preparing to do the application. Okay? Then you have to figure out, well, what did I actually apply? Okay, so when you set up the plots, you're either going to be walking or having some a tractor or something that's moving, right? So you're moving from one end of the plot to the other end of the plot, okay? And that is called a pass time. So that's the amount of time that it takes you from the beginning, one end of the plot, to the other end of the plot, okay? The time that it takes you to walk from one end to the other, if you have the sprayer on your back, for example, and you're spraying, then that's the amount of time it takes to pass. Okay, so you have to record that down in the field data notebook. So the application is considered acceptable if the accuracy is within minus 5% to plus 10% of the target rate. Okay? Okay. Can we now go down to section 17? So section 15, we already made the application. So what we've done is we know what the test substance is. We've been told how to set up the plots, how far apart they need to be. We've been told how to calibrate the sprayer, We've been told what is an acceptable calibration. We've been told about the treatments, what the active ingredient, what the rate should be, how much water or the spray volume, the timing of the applications. That was in section 15. And now we're going to go ahead and harvest the samples. So here in section 17, reviews the sample collection. Okay. So for all trials, collect 2 samples from each plot, 1 day after the last application. For decline studies, on the last day of application, after the spray has dried, collect 2 samples from each plot. Collect enough fruit to yield a minimum of 12 fruit or 3 pounds, but preferably not more than 6 pounds. So you collect 12 fruit or a minimum of about 2 kilograms. Okay? And then you'd go back and harvest again at 1, 3, 7, 10, and 14 days after the last application. Okay? And now we can scroll down to section 18 of the protocol. Okay. So for a normal residue study, a standard trial, you'd have the untreated sample, and then you'd have 2 treated samples. And they all say the amount that you need is a minimum of 12 fruit. Then you scroll down to the next section 18.2. Very good. So here you see that we have, in this column, we have the number of days after the last application. So we have 0, 1, 3, 7, 10, and 14. So a letter has been added to designate the sample ID. Okay? So you take 2 samples with 12 fruit each at each of these time intervals. Does anybody have any questions over what we've covered in the protocol so far? If you have some questions about the protocol, please put that in the chat box. Okay, section 19. Residue handling and shipment. Well, I think all of you will be handling the samples, you'll be collecting them, and then you'll probably be bringing them directly to a freezer of a laboratory, either your own laboratory or a laboratory of someone else that you're cooperating with in your country. I don't think we're going to be involving shipment of samples, although IR4 commonly does that. So when you collect the samples, if it can't be placed in a freezer within approximately 1 hour, use an appropriate method of cooling the temperature monitoring samples in order to maintain integrity. So the way we'll usually do this, when we collect the samples, we'll put them in an ice chest, usually with wet ice, and these are going to be in waterproof bags. We usually use cloth bag with a plastic liner inside, and these are waterproof. And so you put them on ice, or you could also use a blue ice packs to cool the fruit off, or whatever the samples are, between the time that you collect them and the time that you put them in the freezer. So when you bring them to the freezer, you may want to reduce the size of the sample. You don't want to do that in the field. You can only cut samples right at the place where you have the freezer. So you can quarter samples to reduce the volume, and then you have to stick them in the freezer. That freezer should have a freezer log. In other words, what samples are in the freezer and what samples are removed. Also, that freezer must be monitored for its temperature and generally held at minus 18 degrees centigrade. So I hope all of you either have a freezer in your facility or maybe at the facility where the laboratory is located that can maintain samples at minus 18 degrees centigrade. Okay, section number 20. Field documentation and record keeping. So all the data and deviations appropriate to the study should be recorded directly and promptly into the field data notebook. And you will receive field data notebooks prior to starting this work. So the kind of information includes the names of all the personnel, the amendments and deviations, as well as the protocol, the test site information, plot maps, test substance receipt, use and container substance deposition, test substance storage conditions, including their temperatures, data regarding calibration and use of the application equipment, treatment application data. Remember, the calibration is what you're doing with your equipment before you make the application. But you also have to record the actual application data itself. So you will describe how you're mixing up the test substance with the water, and you'll be recording the amount of time that it takes you to walk from one end of the plot to the other end of the plot. They'll also include information on any other crop maintenance pesticides you may need to use to keep the crop growing properly. Okay, if you can scroll down a little bit. Okay, so additional things you should keep records on are residue sample identification, collection, storage conditions, and handling. Okay. So I mentioned 3 to 6 pounds or about 2 kilograms. Those weight measurements are just approximate, and they're not critical, and they're not considered GLP. You also want to maintain any records on residue sample shipping. That's if you're shipping them. Any records of crop destruction, meteorological information, so that weather data, past times, in other words, the amount of time, again, that it takes you to walk from one end of the plot to the other end. Equipment maintenance records, an indication of routine versus non-routine nature of maintenance. Okay, we have a question I see here in the chat box, which has come up. And if we have pesticide residue decline data from the samples harvested 1, 3, 7, and you left out the 0, but that's okay. So 0, 1, 3, 7, 10, and 14 days after the last application. How can we use this data to calculate the MRL? How do we use the OECD calculator? The OECD calculator, the information, the data that you would put in the OECD calculator would include the residue data results. So how many part per million you found in particular samples over time. And you're not really creating an MRL over time. You're seeing what the what the average residue concentrations are over time. An MRL is usually based on a specific period of time. So how can you use it for determining the pre-harvest interval? Well, what we're going to be doing in this study, we're trying to mitigate residues. So we're going to be looking at different markets around the world for your products. So for example, if you grow dragon fruit, or you grow basil, or you grow rice, and you have a certain residue on that crop when you harvest it, what we want to look at is how long do we have to wait until the residues go below the level that is acceptable to the importing country. Okay? So we can look at individual country MRLs where they exist. We can look at Codex MRLs. We can look at EU MRLs. In most cases, the lowest level is probably going to be around 0.01 part per million. So we will target a pre-harvest interval for the time that it takes to go at or below 0.01 part per million. I hope I answered your question. So we're going to be doing some preliminary studies with the decline data to determine how long we have to wait until we can safely harvest the crop. And then in phase 2, we're going to come in with some type of biopesticide so that we can maintain pest management while still allowing the conventional pesticide to degrade. I hope I answered your question. Okay, so can we skip down to section 21? Okay, so 21, so protocol or SOP modifications for field research. So you consult with the study director, and if the regional, that's not applicable to you. We're not going to have regional directors. The protocol prior to occurrence, if appropriate, an amendment will be issued. Any deviations from the protocol will require the field research director to write a report outlining the changes and provide this report to the study director promptly. All deviations from the approved SOP also require documentation and approval by who? Who do you think is approving any protocol changes, or whether you want to call them amendments or deviations? Who has the authority to approve any of these changes? If you'd like, you can try to answer that question in the chat box. The answer is right there on the screen on who has the authority. Very good. I see the initial. Yes, again, study director, SD, study director. Very good. All right. We can skip down to section 23. So this is a list of the people, in this particular case, who conducted these trials. So these were the sites and the testing facility where the test substance was applied. And these were the field research directors. So you can see here the heading for this column. This is field research director and their contact information. The ID number. So each trial at each location, even if it's the same location, gets a unique number. Right? So we had trials, in this case, we had 2 in Florida. We had 1 in Puerto Rico. So Puerto Rico is an island that's south of Florida. We also had 1 in Hawaii. Scroll down a little bit. All right. So that describes the field research directors and identifies them. Okay. Well, I think that's probably it for the parts that I wanted to review in the protocol. Does anybody have any questions about the protocol? Okay. So if we can change to the next part of the presentation, which is on standard operating procedures. Okay, so while Nui is trying to get the set on the standard operating procedures, I'd be glad to answer any questions that you might have about the protocol. So we reviewed the parts of the protocol related to the field aspects. Wayne had covered the field aspects. So again, I will be providing copies of all this information for you, both the GLP overview, the protocol, which we just reviewed. So this was an actual protocol that was used in the United States in 2015 to describe the work that was done involving spinosaurum on dragon fruit. Okay. So Nui, if you can change what we are seeing to the standard operating procedures, either you or Cell, whoever is controlling that. And again, if there are any questions that you might have about the protocol we reviewed, you can simply type that in the chat box. So we still have 72 people online. Wow, that's fantastic. All right. So again, if you have any questions about the protocol that I reviewed, please let me know. Now we will just briefly go over what some standard operating procedures are like. So I think I provided two. You could bring up the one either for Hawaii. I prefer the one from Hawaii because that coincides with the protocol that we reviewed. Again, are there any questions about anything that we covered in the protocol? If you're not answering a question or asking a question, if you can please mute your lines. I think Lakshani, can you please mute? Thank you very much. Okay. I think it's probably a relatively large file. So the standard operating procedures are pretty big.
Michael, we're having some computer glitch here with Nui. So
Okay.
can you just, okay.
Okay.
Even me, I just started, okay. You can go on, and she's still working on the slide.
Okay.
Some internet
All right.
connection or something like that.
Oh, internet connection. Okay. So can any of the other presentations?
เก็บหูเหมือนกันค่ะเอาไม่สมอง
Okay, Michael, it's working now. Apologies on that. It's up now. The slide is okay now. Where's Michael?
So there's a problem. I can't hear you.
Hello?
No, Sel, I can hear you.
Okay, I can
Somebody
hear
has
you.
typed. I can hear you fine, Sel.
Okay,
So
okay.
there's somebody has typed in the chat box. Sovatsan has typed into the chat box. I can't hear you. So maybe if it says fine now. Very good. All right, thank you. So the protocol that we just went over involved several locations, trials that were conducted in Florida, Puerto Rico, and Hawaii. And so each one of those locations has their own standard operating procedures. Okay, so if you can scroll down. Keep going to the next page where we can see the table of contents. So one of our field research centers is at the University of Hawaii. So that's where we do some of our tropical work, like dragon fruit, for example. So I'm not going to go into all the individual SOPs. I just want you to see what topics or what areas are covered by field SOPs. So they start out with 1-1.3, which are the standard operating procedures, personnel records. Just keep it up there, please. Thank you. About recording raw data, determining significant figures and rounding numbers, transferring field data notebooks and raw data to IR4, how to select a site, plot layout requirements, crop establishment, maintenance, and destruction, collecting phytotoxicity data. In other words, that's in case there's any injury on the crop, receipt and storage of test substance, determining the spray volume, determining test substance and adjuvant, measuring the test substance, transferring a test substance, general procedures for mixing a test substance, procedures for application, cleaning equipment, then the equipment itself, how to calibrate the equipment, and also maintenance, use of standard weights, use of automatic pipetters, maintenance of boom sprayers, backpack mist blowers, granular applicators, and flow meters. Maintenance of anemometers. Anybody know what an anemometer is? If you think you know the answer, you can type it in the chat box. Okay. Calibration, use, and maintenance of a sling psychrometer. What does a sling psychrometer measure? Calibration, use, maintenance of min-max or max-min thermometers. Okay, so somebody has come up with the first answer. Wind speed measurement. Very good. So an anemometer is something for measuring wind speed. Very good. So how about a sling psychrometer? Does anybody know what a sling psychrometer measures? They have an SOP for calibration and maintenance of combination temperature and humidity meters, maintenance of hobo recorders. A hobo recorder is something that receives information on different types of parameters, and it's also known as a data logger. So these data loggers store data electronically, and you can put them in something with a probe. So you could attach a wire, and it may have a thermometer that might go in your freezer to monitor the temperature in your freezer. And that temperature is being transmitted to this little hobo or data logger, and that data logger is storing that data. Calibration, use and maintenance of GPS receivers, calibration, use of new or borrowed equipment, maintenance and use of freezers. Don't change it yet. Okay, so I asked a question earlier. Nobody's come up with an answer. Does anybody know what you're measuring when you're using a sling psychrometer? What are you measuring? Yeah, what is a sling psychrometer? That's the question. To measure humidity and dew point. Very good. We generally don't measure dew point. We do record the amount of dew present, but it's really the main function we use it for is to measure humidity. Very good. And more specifically, relative humidity. All right. Now you can scroll down, please, Nui. Okay. The next SOP they have is from use and maintenance of sensophone monitoring system. That's an automated system whereby if there's a problem with the freezer, they will receive a phone call. Okay. Calibration and use of thermometers, how to go about shipping, residue shipping, sample shipping procedures. And then, so there's some kinds of work that they do in Hawaii that is a little unique. Not to you in the tropics, but for anybody in the U.S., there aren't that many places in the U.S. where we grow coffee or pineapple. So they have standard operating procedures on how to process coffee, how to process pineapple. And again, I will supply all of this information to you, not only just these titles, but the entire SOPs. Okay? Can you scroll down to the next page, please? So this is the very first SOP, and this is an SOP that describes how to format all of the other SOPs. So I went over the list of the SOPs that they have. We don't have time to go into each individual SOP, but you will receive them by the email. And all of you will need to have SOPs. And maybe you already have SOPs, maybe you don't. If you'd like, you can go over these SOPs and you can adopt them as your own SOPs. Okay. So the field research director would probably want to be the authority to write the SOPs or to decide whether or not they want to adopt them. And that would have to be approved by their facility management. Okay. Can we scroll down a little bit? scroll down a little more, see if we can find a signature. Okay, so they don't have signatures on each individual SOP. That's unusual, but that is the way that they have apparently done it. Anyway, that completes the section. So I just went over a list of the SOPs. I don't have time to go into each SOP. That would be an entire day just in and of itself. So you could look over those and read them by yourself. Okay? All right. Now we have time for a break. So we'll be on a break for 10 minutes. And when we come back, we will start quality assurance auditing. So Nui, if you can bring up the SOP for quality assurance. Now that's not a University of Hawaii SOP. That's an IR4 headquarters SOP. So if you can find the auditing SOP, or if you cannot locate that, if you could just locate, actually it's better to locate the form. So the quality assurance form for the in-life audit. And we will go over that when we return. So we are on break until, New York time. We are currently at 7:34, so we'll come back at 7:44 New York time, or 6:44 Bangkok time. So we'll come back at 6:44 Bangkok time. Okay? If anybody has any questions, you can please type them in the chat box, or you can also